Welcome to the Business Spotlight series. My name is Kay Cote, and I am your podcast host here at Action Coach in Central Texas. And today we have Dr. Kara Hartl, founder and CEO of Troy Medical, as my guest on the show. We're going to be talking about her business, her journey to business ownership, challenges, best practices, and share a sneak peek into what it's like to own and operate a business. If this is your first time on our channel, be sure to like and subscribe to get notifications when we drop episodes like this one. Welcome, Dr. Kara. It's so nice to have you on the show. I'd love to hear a little bit about you and give us a brief overview of your business.
Great. Thank you so much for having me. I love being here. So a little bit about me. I am an ophthalmologist by training, so a specialist doctor, surgeon, and the most notable thing is probably the crazy thing I did straight out of residency, which was to move up to interior Alaska and start a medical practice from scratch, day one out of residency. Everybody thought I was a little bit crazy. But I'm an entrepreneur, so I probably am a little bit crazy, aren't we all? And it was the road less traveled, and without a doubt, it has made all the difference. I spent 15 years practicing up there as an ophthalmologist. I grew my business from the ground up. Literally, my residency, I trained at this absolutely unbelievable program called Bascom Palmer, which nobody's ever heard of unless you're an ophthalmologist. And then people are like, "Whoa, you're the real deal." I'm like, yeah. So like back at Bascom Palmer, I would sit there with my tape measure, like measuring all the rooms, getting the serial numbers of all the equipment, so I could basically carbon copy Bascom Palmer up into Fairbanks, Alaska. And I did. It was amazing. I started with 4 exam rooms. Within a year and a half, I was crawling over myself, like trying to, like there was no space for anything. I had to hire another doctor. Like now we were sharing 4 exam rooms. Within 5 years, I built a 30,000 square foot medical center, hired a couple more doctors, opened up a retail optical shop. We had a multi-specialty medical center. In the meantime, changed everything within what we had in interior Alaska. Got the new OR up and running. We had probably the most state-of-the-art operating room certainly in the state of Alaska, rivaling anywhere in the lower 48. Had pharmacy offerings. Again, I talked to the pharmacist, Serafin Gonzalez, God bless him. He gave me his entire recipe book for all the things you could do for the eyes. And so we had the Bascom Palmer recipe book available up in interior Alaska, 400 miles from the big city. It was amazing. And I know it was definitely the road less traveled. And that's when I discovered how much I love running a business, being a business owner, taking care of my patients, taking care of my staff, like making something truly special. And then COVID hit, and medicine's interesting. In the pandemic, most doctors will acknowledge that it was interesting times. But one of the things that it did do is it opened up this opportunity of telehealth. One of the problems that I had in Alaska practicing ophthalmology was that when I diagnosed somebody with multiple sclerosis because they presented with optic neuritis, where you go all black blind. And let me tell you, somebody goes and sees a doctor if you go all blind one day. And so we can diagnose a lot of things, a lot of neurology, a lot of rheumatology, certainly endocrinology. My type 1 diabetics were going blind with proliferative diabetic retinopathy. And we had no endocrinologist, no rheumatologist, no neurologist. We had no ologist. The nearest ologist was 400 miles away and had a 6 to 8 month wait list. So I literally lived access of care problems, and they were my patients, and I couldn't fix it. And it was so difficult. And when COVID validated telehealth, suddenly I could actually bring the doctors right into my clinic because I knew how to get it done. I could get the labs, the infusions, the radiology. I could do all of the plan implementation. I just didn't know how to treat lupus. I can't manage someone's type 1 diabetic insulin pump. So I was able to bring those doctors into my town through my clinic and my community. And this was the genesis of Troy Medical. And it was it exceeded my expectations. It was saving lives left and right. It was amazing. It is amazing. And because of that, and seeing what I could do, and suddenly the idea of like, there are 74 million people living in rural and underserved communities. who desperately need access to medical care. And my model is totally different from what other telehealth companies are doing, and it is drastically improving lives. And so I decided that Troy Medical was that's where my passion is. And so now I'm scaling Troy Medical across Texas, and then we'll take it nationwide.
Wow, I can hear the passion in your voice, and I absolutely get fired up for entrepreneurs like this, especially when it comes to health and in the rural communities. Like my mom lives in a rural community in North
Mhm.
Dakota, and she talks
Mhm.
about the struggles as she's
Right?
aging to good health, especially eye care. She actually had said that. So I think what you're doing is so, so important, and I'm super excited to dive in deeper into what you're working on. And so you mentioned, you're the founder. I'd like to hear about, like, do you have, how many staff members do you have? Like, what does it look like in your office?
So my staff is amazing, absolutely fantastic. So we're all virtual, which means that I'm able to source my staff from anywhere in the country. But that also means is that like I can really pick like the best of the best, and I love that aspect of it. So I have my COO, who was my second hire. So my first hire was somebody on the ground who could help like figure out the logistics of actually making this happen. And then my second hire is, I mean, she is just a gem. Her name is Abby Sanasak. She's amazing. She's my COO. She is the get the job done person.
Mhm.
So we run our business on EOS, the Entrepreneur Operating System. So I'm the visionary, clearly. She is my integrator. She's like, all right, Doc, what are we doing? Let's nail it down. Let's make it happen. What's our process?
Mhm.
And so she is the perfect complement to me and is amazing. Just think she walks on water. Um, my other C-suite is Stephanie, and Stephanie Thompson is equally as amazing. She's one of those people that was just starting out and hadn't quite figured out exactly where she was going to be. And then when she got her feet on the ground in my company, has just like spread her wings, taken flight, and you're like, oh, how about that? Well, you're going to be the director of operations because you are just doing it. She's absolutely spectacular. Then we also have several MAs on the ground who are direct to patient care. And then we just started our nurse clinical manager to do care coordination. And Christine is fantastic and is a brilliant nurse operating our principal care management. We just brought on our first IT person because medicine has a ton of automation that needs to happen. And so Abhijay is the one doing all the work behind the scenes. I can't even tell you what he does because it's the coding stuff and automation. And he's like, oh, I'm using blah, 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 blah thing and we're doing it. Blah, blah, blah. And I was like, oh, awesome. Can you show me the demo? And you're like, whoa, that's cool. Keep doing that. Whatever that is. So we're doing a lot of medical automation. Medicine needs to be automated. And so he's basically, I'm a little better than that. He's using Playwright and Microsoft to like navigate automating medical credentialing. And we're going to do some authorizations. And so he's the one in the back end taking these stupid laborious processes and making them easier to do so that a computer bot is doing them as opposed to a human. And so that's amazing. We just hired our first person to get out and explain the value add. I wouldn't really call it sales, but we're not selling anything because nobody buys anything from us. But what we can do and we need to do is we need to explain the value add to the rural communities so that they say, oh my gosh, of course, like please come and do this. We need this in our community. And so he's their first hire. He starts August 1st to get out there. So we have an amazing team of spectacular people who are excited about starting something from the ground up.
Oh, I absolutely love hearing about that. And I'm very curious to what your day-to-day looks like. Can you give a brief overview of your day-to-day? I'm sure it changes all the time, but what's kind of a typical day for you?
So, well, I still practice medicine. So my non-medicine days. So I have days where I'm doing telehealth. I walk my own walk. So I also work for my company as a doctor. So I can tell you what today was. Today I volunteer for an organization called Entrepreneur Organization of Austin. And I absolutely am passionate about entrepreneurship, and especially in youth. I have two spectacular children, ages 14 and almost 16. And so I love helping bring entrepreneurship into the next generation. So I'm working with actually UT and Capital Factory, trying to create an event to honor student entrepreneurship. I've started a youth entrepreneurship award through the EO of Austin, our chapter, and celebrating youth who are doing amazing things in entrepreneurship. That was my first one. Second one, I'm launching ways to improve the efficiency models within medicine. There's a ton of stuff we need to do to improve efficiencies, and so that's one of the things I love doing within medicine. So basically, it was meeting, working on my computer, working on my sales pitch, working on my deck, and now I'm doing a podcast. And then in another half hour after that, I'm meeting with an advisor to help me on the next steps of growth. This is the first company that I've had that truly I could scale almost infinitely. It feels infinite. 74 million people, that's a lot of people to go help.
Yeah.
So that feels like an unbelievably huge number of people out there. And I know that there's a lot that I don't know. And so I've collected a cohort of really brilliant advisors who frequently will help me. Okay, here's where you're gonna hit a pitfall here. You're gonna have a hurdle there. Think through this. Like, how do you navigate a culture? I've previously grown from 0 to 35 employees. I've never gone from 35 to 100 or 100 to 1,000. And those are different skill sets. And so I'm spending a lot of time educating myself. I'm getting advice from people who've done larger companies, and hopefully I'll be better through those hurdles than I would have been otherwise.
Oh, yeah, definitely. That's really, really incredible to hear how you see that vision, across scaling the company. And, kind of looking into, we talked a little bit about your client base, who you serve. And so, what makes your business unique? We've covered a lot of that as well. And so, how would your competitors compare with you?
So here's the crazy thing. In my specific vertical in rural America, I can't find any competitors.
Hmm.
Telemedicine is doing a ton of things. They're doing tele-urgent care, tele-primary care, teleconsults, tele-inpatient, tele-ER, but we are long-term management of chronic outpatient disease. So
Mm.
we are, what do you like, not the hospital, like there's lots of people doing telemedicine in the hospital, helping the docs, helping the inpatient, navigating critical care. But what do you do when they get discharged and they go to their primary care doctor, but the primary care doctor, like, this isn't like, it's a specialty level care. This is something that needs to be more than just a primary care doctor. This needs to be a rheumatologist or a neurologist. And
Mm.
so that's what we provide. We provide long-term care. So that's the same rheumatologist managing your lupus or your rheumatoid arthritis on the long term, getting to know you in your community. So the people working in that exact demographic, it's crickets out there. And
Mm.
I think part of it is because the model needs to be different. It can't be pure tele. There's too many things to navigate. It has to be a hybrid model, which is what our model is. And so we help patients, we help walk them through connectivity, the technology, their disease process, where do I go for this? How do I get that? Follow up on the labs and the radiology, get all of that stuff done. It's almost like concierge, except it's paid for by insurance, so it's fantastic.
Mhm.
And so that model allows the actual get the job done in this particular market.
Mm.
So one of the things that we struggle with is because we kind of are first to market in this, people don't understand it. And so sometimes I'll get oh, you're another telehealth company. You're like, no. Like, we're doing this and nobody's doing this. They're like, well, I don't understand. I'm like, okay, well, here's the model. So one of our biggest hurdles we need to figure out how better to overcome that we're working on right now is how to explain to someone exactly what it is and exactly what the value add is. Like, once they understand it, the value add is patients stay local, they stay in their local community hospitals. The community hospitals benefit because they're actually able to keep the labs, the radiology, the infusions, all the outpatient procedures in their hospital that helps their hospital stay viable. The primary care doctors get to close the loop of like, where did the referral go? And when you refer and then they go off, did they get them? Do you find out, like, did it come back? And so they're able to close the loop of like that full comprehensive patient care. And then for the patient, they don't have to wait 6 months or travel an hour and a half each way. It's kind of brilliant for all of them. And so that's kind of where we are right now. And some of the struggles that we need is being first to market means that you need to explain what the market is.
Hmm. Definitely, which actually leads perfectly into the next set of questions, which is about marketing yourself and how you're doing that. Because who would you say your first target is, your first like customer client? Is it other hospitals, or how does that work, and how do you market to them?
Excellent question. And I will hopefully have a much better answer for you in a few months when our marketing and salesperson joins, because I'm hoping he can help a little bit more with that. Our market demographic really, honestly, are mostly the CEOs of community hospitals. Those are the people who understand, they're in charge of the hospital and oftentimes the associated primary care clinic. Typically, hospitals have rural health clinics or federally qualified health centers that are associated with that or somehow in their ecosystem in the community. And that's where we work out of. So we actually partner with those community primary care clinics. We work out of their facility. It's a build through Medicare, through insurance companies, and we can essentially borrow a little piece of that, a piece of their clinic, and then that's where we work in and out of. So it actually, again, it's within their ecosystem of where do patients go? Well, they're right there. So if you want to talk to the doctor and the specialist, you can pop in, hey doc, can I give them this while they're on that? Awesome, thanks. You can have those like really tight communication that makes for great medicine. So explaining the value add to them, getting that door opened. No, we're not just another telehealth company. We're doing something that nobody else is doing. Here's why you want us. So right now I probably could use some advice from people who know better how to do sales and marketing than I do. I'm a doctor. I can fix things, but selling things is a tough one for me. And so again, we're doing podcasts like this, written a bunch of articles. We've been at the Texas Organization for Rural Community Hospitals. It's a great organization in town that is an aggregate of all of the community hospitals. So that's a good, so I've been to their meetings. They're going there again. We're starting some early studies for the impact of the intervention that we can offer patient specialists and their health outcomes get better. It's not a shocker, but having an actual study that shows that. So we're doing a lot of the, value, like explaining the value add. Admittedly, I'm sure we could be doing it better.
That's incredible. I like the vision that you have for that as well. And kind of leading into, what are your goals for the next 3 to 5 years in business?
Mhm. So this is an impact company. This is a mission-driven company. I mean, there's 300,000 people in Texas alone who are suffering from this exact issue. They need specialists, they can't get them. And we have a model that gets it and gets the job done, really, really high quality medicine. And so my goal for 3 to 5 years, I can tell you my goal in 1 year is to be in 10 to 20 more locations. And my goal in 3 to 5 years is this problem exists in every single state, everywhere. We did a needs analysis, and honestly, it was overwhelming. It is so necessary. I mean, you talked about in your parents in North Dakota. Yep, that's an easy one. Hawaii, terrible access to care issues. They literally have to fly between islands. You don't think of like Hawaii being medically underserved, but like their access to care problem is enormous. And California, think of California as being medically underserved, the #1 medically underserved state. It is literally everywhere. And so because this company is mission driven, I mean, my goal is to get to as many of these people as is humanly possible, as fast as possible. That's why I moved from Alaska down to Austin, is realizing the impact that I was able to make with this company. As much as I love being a doctor and a surgeon and taking care of my patients, like my greatest impact is spreading this model to all the people who need it. I mean, the company was named after the patient that inspired me to start the company, Troy. He desperately needed this, and so I started this for him and all of the other Troys. And the reality is, like, there are Troys everywhere in this country, and people who care about their patients and need to get them more care. And so that's what I'm doing.
That is like, gives me like chills in the best of ways to hear that you're making such an impact with this. This has been a great conversation. I'd love to dive into some rapid fire questions with you.
All
4 questions, top of mind. And so, question number one is, what is the key to success for you?
So, gosh, the key to success, honestly, I think is you just keep going. So no matter how many hurdles you come across, no matter times you take 2 steps forward and then it seems like 1.5, 1 3/4 step back, and it's just like can get frustrating. And anytime you're starting something from scratch, it feels like you're taking a machete and cutting first tracks in a jungle. It's hard. And so the secret to success is you don't stop, you keep going. And when you get kicked down, you get back up and you keep going. And I think that's really the difference between success and failure is at some point in time, you quit and then you failed. So if you never quit, you're keep going. And then eventually you're gonna get over whatever hurdle just because of sheer effort of will.
Very, very good. I love that answer. And what is a piece of advice you have for other business owners?
I would say, so somebody, my brother actually said to me, when you have a specific set of knowledge, like your domain expertise, like you know it better than anybody else, and we all have those, we all do, and you have a really brilliant idea that fixes your pain point, something that drives you nuts, and it's a total problem for you, and you're like, you know what? I have a way around this. This is a brilliant way around this. You just found a company. So if you want to go create something, find something that you know really, really well, something that drives you nuts. And when you find a solution for that, that's somebody else's solution too. I mean, there are many people who are in the same thing, who have the same issues, and that right there is a company. So when you find that, run with it, and
Hmm.
then don't stop.
And what piece of content have you taken in most recently? It could be a book, a podcast, something that that you've taken in.
Ooh, so many. Actually, one of my dearest friends, Kirk Scheilman, and he made a comment to me that was it was completely offhand, and yet has really affected me to my core. He said he'd been fortunate enough to had real struggle, so he knows where he is and what's possible. And it was the framework to me that struggle that we've had is actually a blessing. That we are so lucky when we sit there at the bottom of that pit of misery and you're just like, God, this is awful, that is actually a gift, because when you've had that, you know that you're not there and you know how bad it can get and that you're strong enough to get through it. And just the mere fact that true struggle is actually a gift that the universe gave you, and to relish that and be like, all right, well, I'm doing great. You know what? Like today, I might feel like I'm getting kicked in the teeth, but I'm doing so well because I know what real struggle is, and I'm not struggling. I'm good. And that perspective has been a gift to me.
That's brilliant. That is, I'm gonna thank you for sharing that with me too. I'm totally gonna like put that in here on those days. That seems super hard.
I've been
Uh,
brought to my knees.
oh, I feel that. And if you, final question is, if you had to choose only one area in business you could rapidly improve tomorrow, what would it be?
Honestly, like the thing I would love most is to how to explain, how to translate the vision in my head to other people who might not like, who don't see my head. That's something I could get better at. I know I could get better at it. I'm bringing people into my circle of my sphere of influence, because I know, like, I'm very aware of the things I'm not very good at. I just brought on somebody to help me as doing financial modeling. I'm not very good at that. I'm bringing on people who can understand marketing and sales, and how do you translate your idea into something that somebody else can visualize, and that fits them, and they're like, oh yeah, it's like this. You're like, oh yes, that's exactly it. Perfect. And that is a brilliant skill set, and one that I probably should go read a few marketing books.
Oh, that is incredible. So thank you for answering the rapid fire question. Before we get to our final question of the day, how can people find you? How can they find your company? Feel free to drop any social media.
Yeah, so I am mostly online and on LinkedIn. So if you see Dr. Kara Hartl, you can find me on LinkedIn. If you Google me, conveniently, I have an unusual name first and last, and so I'm pretty much the first page of Google because there aren't many Kara Hartles in this world. Or you can always Google TroyMed, troymed.com. Those are probably the best things. Our social media platform that I primarily use is LinkedIn.
Awesome. Thank you so much, Kara. And the final question of the day is, what is most inspiring to you today?
Honestly, anytime I talk to somebody about my company, my mission, and they get it, and they're like, yeah, I see this, like this conversation that you and I had today, when people validate that, yeah, this is a good thing, this really is making a difference, it fires me up. It gives me, I mean, starting a new company and scaling a new company and doing it from scratch and doing it myself, it's self-funded. This is like when people get it and they say, yeah, this is good stuff. It's like, all right, get another day, work 150% and, make it all happen. So anytime somebody like you sees the value and understands it and say, yeah, Kara, this is good stuff, then it makes me want to get up another day.
Love that. And yes, I definitely see this incredible vision that you're building. And I'm so excited to share this episode. So thank you. Thank you so much for being on the episode today.
Thank you for having me. This was great. Thanks so much.